I'm now going to introduce all of our current standard stock slings that are within our Medequip catalogue. These may change at some point in the future, but the principles of the slings and the designs will remain similar depending on the sling that you're using. So I'm going to introduce, as I said, most of the slings, starting from the most riskiest. So when you're assessing for a sling, it's very important that you are doing your thorough risk assessment, perhaps assessing with different slings of different sizes, measuring for a sling if that's something that you find helpful as well. And once you've done your risk assessment and decided on a sling that meets that patient's needs, you would be filling in your moving and handling plan. And also on Workplace, we've got sling plans as well that you can use. With those sling plans and the moving and handling plans, you can then hand them over to the carers or the staff that are using those slings with patients. So the first one, as I said, the most riskiest type of sling is what we might call the toileting sling. Some might call it the dress sling or the access sling. It's generally this sort of shape. So it has a waistband on it and quite a large aperture. Therefore, this sling does require a patient to have good core strength and sitting balance. So when I'm assessing for this type of sling, I would always request that a patient is sitting on the edge of the bed or sitting in a chair so I can assess their sitting balance. I would be looking for good, consistent sitting balance. If they are able to sit consistently, then the toileting sling might be appropriate for them. So once you have put the legs around a patient's legs, you would then always cross the legs over. You would be doing this with every different type of sling that you use. So this type of sling does come with a lot of risks, but can be very appropriate for some patients depending on what their needs are. But you need to just make sure that they are able to consistently hold their position at that 90-degree angle with good core strength. If they don't have that core strength, there's a risk of folding and slipping through that sling, which obviously is what we don't want. Moving on to the next sling, we have got here quick fit sling. With all slings, they all have a safe working load, and this sling has a safe working load of 227 kilograms. As you can see, this one has shoulder straps and leg straps. This sling also has a loop here, and with this loop, if you had an above knee amputee and you needed to hammock the sling around the legs, you could do that just by putting one leg through the other. With hammocking a sling around the legs, you need to be very careful and risk assess that very carefully, because in that situation you wouldn't have the legs coming up through the legs, so the person might be much at higher risk of falling out of that sling. So that needs to be very carefully risk assessed. There are pros and cons with all of the slings. With this one, it's very thin material, it might not be so comfortable to be hoisted in. It has padded legs, but the edging of the fabric is a little bit rough, it's a little bit, could cause damage to the skin. But on the other hand, it has nice long legs, so it's quite easy to put underneath a patient. When using any sling, it's very important to always check the fabric for any tears or any damage, so make sure that it's in really good working order before you use it. And as we've said before, make sure you check the moving and handling plan and the sling plan, if there is one, to check any special instructions. This is a large version of that quick fit that we've just looked at. So it's large, it's got the green edging, and the last one, which was medium, has the yellow edging. So moving on to the next one, this is a single patient use sling. These types of slings are ones that you might find in our pathway to rehab centres. Same shape as the quick fit, we've just got the shoulder straps and the leg straps, and you need to make sure that you're crossing the leg straps every time you use it. So we're heading up towards the safest type of sling. We have our Joanne's Oxford, or Oxford Joanne's. These slings are much safer because they've got a much smaller aperture. They've also got leg straps, hip straps and shoulder straps. This one also has a neck roll, so you could roll up a towel and just put it through here, which could support the neck a little bit more. Also, you might notice on this one, it's got this big strap here. This is actually called a reflex sling. So if you have a patient with involuntary movements or spasms, then the back of the sling can actually move within the spreader bar. So this strap here would go through the outside part of the spreader bar on that outside clip, which means that it can move forwards and backwards as the patient moves. So you would always make sure that the leg straps are crossed and then the hips go through the legs. Lovely, safe sling as long as applied correctly. The next one is our Oxford Joanne's sling. This is a standard sling, not a reflex sling, so we have got loops on the shoulders. So this is better for getting a better position in the chair. So by using those loops, you usually the shortest on the shoulders and the longest on the legs, you can get somebody into a good seated position in a chair. With these types of slings, you might notice the legs aren't so long, so the legs of these slings might be a bit trickier to use with a patient with larger legs, but really good safe slings to use. Then moving on to, this is our Oxford Joanne's ultra fine sling. This is similar sort of shape to the last ones, but you will see that the material that goes around the legs is really quite short this time. So a little bit trickier to bring around somebody's legs, especially if they've got larger legs. This one also has a head support. Again, you would be crossing at the legs and pushing the hip straps through the leg straps. The next one is currently a reissue sling. So this is the same shape as the reflex and the other Oxford Joanne's. This has got shoulder straps, okay, with separate loops, and you would again cross the legs and put the hips through the legs. This is made of that black spacer material, so this is an in situ sling. But when assessing for an in situ sling, you'd have to be aware of the patient's pressure needs. When you've got this on a patient, when they're sitting in a chair, you could fold the legs back out the way if that helped reduce any pressure injuries to the legs. And finally, we've got our hammock sling, which is a hammock style, sort of a rectangular shape with a cloth pommel coming up through the legs. This one, because it hammocks a person, it's quite a nice, comfortable sling, but it's also quite difficult to get that really good right angle. So when transferring somebody into a chair, it can be a bit tricky to get that nice right angle. But a good, safe sling to use. The most important thing with this is when applying the sling, make sure that that bottom edge is just above the knees, where the knees bend. We don't want that pommel coming up in towards the groin. This again is that black spacer material, and it's good for in situ purposes. Safe working load on this one is 200 kilograms. This is a medium due to that yellow edging. So that's our selection of slings in the current standard stock catalogue.